Major kinds of alpha herpes. Remember, that's an arrangement of the genes. The alpha arrangement. And the alpha arrangement results in 3 different diseases. There are 3 distinct viruses. One is herpes simplex type 1. So it's called HSV1. And these are Arabic ones. It does make a difference. Not a Roman numeral, but an Arabic one. And this is the one that if you're exposed to it as a child, you will have it the rest of your life. And about 80% of us have fever blisters or cold sores. That's herpes simplex 1. It's contagious when you're a newborn and your immune system is not developed well. So that means that if Grandma wants to come see the new baby and she's got a big old fever blister, show her a picture. Do not let her come and touch the baby or any baby toys, because what do babies put in their mouth? Everything. So you do not want anyone with a fever blister around a baby under the age of 5 or 6. When they have fever blisters, tell them to go somewhere else. Go play with the adult kids. There's some 11-year-olds, go play with those. But don't let them around an infant, because if the infant's immune system has not formed well, they could pick it up if they have a fever blister. And remember, the fever blister is weeping millions of virus particles. All right, so if you don't get it by the time you're 5, 6, 7, 8, or 9, you probably won't have it until you either get HIV, which destroys your immune system, or cancer or radiation, which destroys your immune system or cuts it off, or you get really, really sick and weak and in the hospital with a very high fever, then you can pick it up. But essentially, because right now in this room, somebody has a fever blister. Right now, somebody has a thing on their lip. Yep. And as a result, there are flakes in the air of skin and scab from these fever blisters that you are breathing in all the time. And it sort of keeps your immune system sort of charged up. So because it's all in the environment everywhere, in every room of 25 people, there are at least 2 with current fever blisters. 1 healing and 1 starting. Now, what causes them, remember? You get the virus and it lives in your neurons, your ganglion of your neurons of the lower back and upper legs for the rest of your life. Once you get it, you got it forever. It's not like marriage, where you can get a divorce later on. You know, don't like the color they change their hair, you divorce them. All right? Nope. Herpes is a real, true friend. It's a friend forever. Once you get it, you got it. And there's nothing you can do about it. Now, you can reduce or prevent the infection by taking an antiviral whenever you have the early symptoms, what they call prodrome. Before you get visible signs, there are ideas and symptoms of infections. Those are called prodrome, and the ones for herpes outbreaks are backaches and upper leg aches. People will go, oh God, I think I pulled my back lifting that lat. Oh my God, I'm going to have an outbreak. You learn to recognize it, a stiff back or an upper leg ache, as not something where you pulled a muscle or strained something, but as a prodrome to an outbreak. The next thing is they always come back to the similar area where you had them before, so it will get numb. You know how if you pinch yourself a whole bunch of times, it gets sort of numb there? That's what it will feel like. So it'll be numb at the site where there's going to be a lesion. Then it will be reddened and discolored, and then you'll see a clear blister that will fill with virus particles. If you take your antiviral, when you hit the backache or you feel the numbness, you won't have the outbreak. If you take it after you get the lesion, you will shorten the outbreak from 14 to 21 days to 7 to 12. So remember, once you've got an actual symptom, a sign is what we call it. Does anybody know the difference between sign and symptom? A sign is something that you can see. A symptom is self-reported. So dogs never have symptoms because they can't talk. They have signs, visible changes or things you can observe from the outside. So anyway, remember that what activates these viruses that are hiding in your ganglion? Remember, they're hiding in neural tissue, so they cannot be exposed to the immune system, so the immune system doesn't know they're there. They're not replicating, so they don't stimulate the immune system. They're just dormant in the ganglion of your lower back and upper legs. What activates them? The fight or flight hormones. Those hormones that you release when you're extremely angry, extremely happy, or extremely upset, or under stress. The stress hormone. They activate them, they travel down these neurons to the exact same spot, and then they go through this whole phase, and then as the lesions develop, your immune system begins building up antibodies and forces them back into hiding. And then you have healing until you activate them again. So, that's generally what happens. Now, herpes simplex 2 is incredibly contagious. It's so contagious I can't even describe how contagious it is. That's how contagious it is. We used to think that genital herpes, by the way, you cannot tell the difference by looking. So if somebody comes with a big old fever blister, remember, people put their faces in many different places. So you don't know if that big old fever blister is the one that's not very contagious, moderately contagious, herpes simplex 1, or the one that's horribly contagious, herpes simplex 2. And what does it take to open up receptors? Underwear or clothing rubbing against your skin is enough to open up enough receptors, so if you get exposed to particles, you will get infection. So it's herpes simplex 2, very, very, very infectious. Can you tell one lesion from the other? No, not without DNA testing.
So they can't tell it from the, what was that called?
You can't tell it from CPE?
Yeah.
Nope. Same CPE. The only thing that can tell is, well, you can tell by how contagious it was when you got it. Not very helpful. And here's the worst thing about herpes simplex 2 that we didn't know until recently, and that is people under stress can weaken it without a lesion. So in other words, if a person is under stress, they will actually be shedding enough virus to infect another person without a sore being present. 70% of all people that get genital herpes from sex with their partner got it when the partner wasn't having an outbreak. They were just under stress. When people are under stress, they shed it without a sore. So this one is extremely contagious. In fact, you know, how much stress do you have in your life? I'd say every other day. So you could be shedding it a lot. So remember, herpes simplex 2 can be anywhere, and so can be herpes simplex 1. The only way you can tell them apart is by DNA testing. So you cannot, if you see somebody with a fever blister, don't be smearing your face all over theirs, don't be drinking after them, don't be chewing on the same pencil that they chewed on. You do not want to get those particles near any of your mucous membranes. Mucous membrane attachment is how they get. And even your open skin can rough up enough to expose receptors. Alright, by the way, this is the one your mother told you about. You know when your mother lied to you about,
don't be setting your butt on any damn dirty toilet seats. Get some paper and set it down. You can get anything that way.
you cannot get anything that way except herpes simplex. Herpes simplex loves moist, warm environments. That's where it lives happily. Where do a lot of people get their herpes simplex to, the genital variety? In gyms. How do they get it? By using a towel that someone else has used. My ex-roommate got genital herpes there. And I said, Robert, what twisted sexual position were you in to get herpes 2 there? And he said, I didn't get it in some weird sexual position. I went to the sauna. You know how you wear a towel around you and you carry one around your neck? And he says, I didn't want to get the one around my neck all wet from inside the steam sauna, so I hung it up on the hooks outside. I came out and someone had taken mine, so I took someone else's. I had a pimple. When I dried, they must have had a lesion, because that's how I got it. And people sitting up on the sides of jacuzzis and hot tubs. Not in the water, on the side. Because you can have a lesion and pop it and not even know it and be sitting up on the side and somebody else could have a pimple or an ingrown hair. Remember, in the water, all those disinfectants kill it. But up on the side where it's moist and warm. So the rule is, when you're in a swimming pool, at a sauna, at a gym, sit on your towel. You get a freshly laundered towel and you sit on yours. And if you're on the side of a hot tub, you put down your towel and you sit on that. You do not sit on any tile surface or anything else that's moist and warm. That's where they live. Varicella zoster is the chickenpox herpes. And good news, we have a vaccine for it, and it works well, and it's now a childhood vaccine. Get it. VZV, varicella zoster chickenpox. Now, if you get chickenpox as a child, it will go and hide in your neurons until you get old. And when you get old, your immune system goes down, and it comes back as a very painful disease called shingles. So if you get the chickenpox vaccine as a child, you won't get shingles as an adult. Now, what if you get chickenpox as a child, and later on you're worried about shingles? They do have a shingles vaccine that you can get in your 50s if you had chickenpox when you were younger. It's expensive, and it's not 100% effective. It only works about 60% of the time, but if you've ever known anyone with shingles, it's a whole lot better than shingles. And once you get outbreaks of shingles, there's not much they can do. So,
what if you never had chickenpox?
If you never had chickenpox, did you get the vaccine? You get the vaccine and you'll never get shingles.
What is shingles?
Shingles is chickenpox in adulthood. It's much more painful. In the old days, they used to do some really strange things. Like I said to my sister once on the summer, Cindy, let's go get a beer this weekend and maybe go to a movie and do some time. And I want some sister time. And she said, nope, I'm taking Noah to get chickenpox. I said, you mean to get a vaccine or something? She says, no, I'm taking him to get chickenpox. There is no vaccine, because there wasn't then. I said, what do you mean? And she said, well, he's going to get it anyway. All kids get it. So I want him to get it when it's summertime instead of during school. So one of his friends have it, so we're taking him over there to play. So that he will get it. And then he won't get it when he's in school. You don't have to do that now. We have a vaccine. Okay, we're going to see the little video and we'll finish this later, but I want to get the complete video through. So the name of the video is The Evasive Invader. Or is it invasive? Anyway, so. And put it in your lab record book front to back.
Some mysteries exist since ancient to modern times. One such mystery affects nearly all our personal and social lives. Herpes, the evasive invader.
Yeah, evasive invader.
Herpes simplex simplex is a viral infection that attacks skin surfaces. It usually occurs as sores on mucous membranes of lips and genitals. The illness is caused by either of two closely related viruses, herpes simplex type 1 or herpes simplex type 2. Both produce similar symptoms, but type 1 generally occurs on lip surfaces, while type 2 occurs predominantly in the genital areas of both males and females. However, type 2 infections can occur on the lips, and genital infections can be caused by type 1 virus. 3 other human herpes viruses are in the same family, but cause different infections. 1, varicella zoster virus, VZV, is responsible for both chickenpox in children and shingles in adults. Another herpes virus is cytomegalovirus, CMV, which primarily causes disease in newborns and patients with severely depressed immunity. The third, Epstein-Barr, EBV virus, is the most common cause of mononucleosis. Herpes simplex virus 1 and 2 usually enter through contact with infected people. Sexual contact is the primary method of spreading genital herpes. Outward signs of the infection are blister-like sores, alone or in clusters, on skin and mucous membrane surfaces. Herpes, like other viruses, are extremely small, measuring only 8 millionths of an inch in diameter. This fragile virus is unable to survive outside the body for long. It consists of an inner core of DNA, surrounded by a protein capsid. Herpes viruses also have envelopes surrounding the capsids. Infection begins when the virus enters the body and attaches to the surface of a living host cell. The outer covering or envelope of the virus sheds, and the inner core penetrates the cell. The virus DNA core then travels to the nucleus, the control center of the cell, and takes over the cell's normal genetic regulation. The host cell is no longer in control of its own life's processes. The viral DNA forces the cell to produce thousands of exact copies of itself. DNA cores are formed within the nucleus, combined with newly made capsids and envelopes into new whole viruses. These new viruses then migrate to the cell membrane and are released outside the cell. Here are many healthy cells with dark nucleus centers. Normal cell division and movement can be seen. As infection begins, profound changes occur in the cells. Normal cell division decreases. Membranes of neighboring cells fuse, and their nuclei merge to form giant cells. These giant cells, called Zank cells, can be found at the sites of lesions. Microscopic examination of specimens sampled from the lesions can confirm the diagnosis of herpes. Infected cells appear to boil, bubble, and erupt, releasing more viruses to infect other cells. As this process continues, more and more healthy cells are destroyed. The tissue damage creates blister-like sores called vesicles or lesions. These lesions are the visible signs of the battle below the skin surface. This is the prodrome phase. The first symptoms one notices are itching, burning, or tingling sensations around the site of infection. The surface area may be slightly discolored and sensitive to touch. After the prodromal stage, one or more marks may appear. These marks develop into raised, fluid-filled blisters with darkened red base areas. Lesions may fuse together, forming a whitish-gray cluster. During lesion formation, in some cases there is sharp pain within the affected area. Muscle aches, swollen lymph glands, headaches, fever, and a general sickly feeling can also occur. Vesicles gradually break open and ooze watery fluids, filled with highly contagious viruses. After several days, the sores begin to dry and crust over. Scabs form, and healing begins. At this time, most symptoms begin to diminish. Underlying skin tissue regenerates until the lesions are healed. Symptoms associated with primary or first-time episodes of genital or oral herpes are usually more severe than those associated with recurrent or repeated episodes. The entire primary episode lasts about 3 weeks. Recurrent episodes are usually shorter, averaging 7 to 10 days. To confirm clinical diagnosis, laboratory tests must be made. The most accurate method is performed by placing a specimen of fluid from a lesion into a living cell culture. These cells are then watched for characteristic changes caused by the herpes virus, and a definite diagnosis can be confirmed. A more useful herpes test, although less accurate than cell cultures, is the pap smear. A gentle scraping of the lesion is placed on a microscope slide. If the specimen contains characteristic Zank cells, or cells with many nuclei, a diagnosis of herpes can be fairly certain. The invasive nature of herpes is quite complex. Let's focus on how the body can fight the virus. The body's natural defense system is called the immune response. A sequence of events takes place beneath the skin surface where cells of the immune system interact with a network of blood vessels, tissue, and lymph glands. The body's main defenses are specialized white blood cells and a vast array of chemical components, such as antibody, complement, interferon, and lymphokines. Lymphocytes, members of the white blood cell defense, gain the ability to identify foreign herpes invaders on the surface of infected cells. They seek out only virus-infected target cells and destroy them before the virus has a chance to mature. Other lymphocytes, called plasma cells, produce antibodies. Antibodies are a series of protein chemicals that destroy viruses. By way of microphotography, we can see the central plasma cell releasing antibodies that spread and destroy foreign invaders, called antigens. Phagocytes are the scavenger cells of the immune response system. They actively wander in search of foreign antigens. Upon finding the antigens, phagocytes engulf the invaders, digest, and destroy them. How do immune cells and chemicals work together to oppose the herpes invaders? Perhaps the best explanation of the defense is through animation. Herpes viruses enter the body through mucous membranes of the skin. They first attach to the cell's outer surface and quickly cause chemical changes within the surface. The viruses then penetrate the cell and migrate to the nucleus, where they increase in large numbers. Neighboring cells fuse together as mature viruses are released and the infection spreads. More cells are destroyed and tissue damage occurs. The body must fight back against this increasing invader. The immune response musters its protective army of specialized white blood cells and chemicals to oppose the rapidly growing invading force. The phagocytes, in particular the macrophages, can identify the enemy by its foreign markers. They actively eat and destroy viruses as well as infected cells. Macrophages also communicate with other white blood cells. The T cells, who carry messages to nearby lymph nodes. In the lymph nodes, the lymphocytes clone themselves and transform into specialized cells, ready to be dispatched to the area of infection. Reinforcements of killer T cells arrive to aid the phagocytes. They patrol tissues, seeking out virus-infected cells, which they destroy by injecting poisons. Other defensive recruits are B cells that transform into plasma cells. The plasma cells produce antibodies, or chemical missiles, that kill viruses. As antibodies attach to the markers of infected cell surfaces, they bind with a series of 9 proteins called the complement system. The first component of complement, C1, combines with an antibody. The second, C2, combines with C1, and so on until all 9 components are bound. The sequence is like assembling an explosive and its detonator. When all the pieces are attached, the charge detonates to explode and kill the cell. Dying infected cells produce a chemical substance called interferon. Interferon strengthens uninfected cells, enabling them to resist entry of the virus. Other chemical messages produced by T cells activate and assist the body's defense troops. All of these substances help to stimulate and intensify the immune response. As the battle grows more intense, there are heavy losses on both sides. In most cases, the body's natural defense overcomes those of the herpes virus and stops the spread of infection. Tissue repairs itself, and healing becomes complete. T and B cells now carry a memory of the herpes identity markers. They circulate and patrol all areas of the body, ready to mount an early attack, more efficiently and rapidly than that of the first encounter. However, some herpes viruses can escape the body's immune defense forces. These evasive invaders retreat and hide in certain nerve endings. They get to these hiding places by traveling along nerve fibers to clusters called ganglia. There, they remain in a dormant or latent state. Since these viruses are not actively replicating, they do not damage the nerve tissue. During this hibernation, the nerve tissue shields the virus. Since the viruses do not reproduce, no cell surface markers appear. Thus, the immune system is not provoked. This dormant stage or latency may be indefinite or continue for varying periods of time. A recurrent infection may occur when latent viruses are triggered by emotional stress, sunlight, menses, colds, or fever. When reactivated, viruses travel back through the nerve sheaths to the same location of the prior infection site. The infection, immune response, and latency is repeated. Since the virus can escape the immune forces, how can the problem be solved? Two control methods are at hand today. One is immunotherapy, and the other is antiviral therapy. The objective of antiviral therapy is to develop drugs that can distinguish cells which harbor the virus from those that do not. The drugs must be selective by destroying virus inside infected cells without harming normal cells. The drug must destroy the entire virus without leaving fragments or producing mutants that may cause later problems. Essentially, antiviral agents must not only be lethal to viruses, but also non-toxic to body cells. Immunotherapy is another exciting new area of research. Immunology researchers are developing agents that help fight viruses naturally by stimulating the body's immune response system. Some currently available substances can activate specialized white blood cells. For example, immunotherapy can increase the number and strength of T cells. Phagocytic activity can also be enhanced. The phagocytes more aggressively seek out and engulf the invaders. Thus they ingest and kill greater numbers of viruses. Immunotherapy can also increase B cell or plasma cell activity. Throughout man's lifetime, the body's immune response has been the first line of defense against disease. Immunotherapeutic agents able to stimulate many or specific areas of the immune response system may ultimately be the key to the safest and most effective control of not only herpes simplex, but other viruses and serious afflictions. Quite possibly, immunotherapy is the key to universal disease control for all humankind. With the ever-expanding increase in knowledge and technology, medical science will be able to treat and control herpes, the evasive invader.
All right, so back to a little bit more of lecture, and then we'll be done with herpes, your friend and mine. Just remember, it's something everyone loves to share. All right, so we were heading into the beta herpes, and the beta herpes are the ones that cause teratogenic viruses. They're the ones that cause horrible birth defects. The name of the virus that is the beta is called cytomegalovirus, CMV. So on the test, if you see HSV1, that's herpes simplex 1, cold sores. HSV2, genital herpes. VZV, shingles and smallpox, shingles and chickenpox. Beta is CMV, cytomegalovirus. Now, if I tested every one of you, drug out some of your blood, remember, don't ever lie on any test, blood test, or any other thing like that. They know everything you have ever had by doing a blood test. So don't be saying, well, they don't know about that time I got syphilis. Yes, they do. And remember, it was the lying that got Mr. Clinton into trouble, not the stuff that went on. All right, so cytomegalovirus, if I blood tested everyone in here, and you wouldn't know if you had it, but 80% of you would be positive. Why? It's a mild disease that you get usually in group situations like in high school or something like that. You feel icky and yucky for a couple of days. You have no energy. You like a low-grade fever. You feel, but then you're fine. You get completely over it. Cytomegalovirus. 80% of us have had it, never can get it again. You're fine. When is it a problem? If you're pregnant and you just get it for the first time, then it can cause horrible birth defects. So that's why it's done as a part of the TORCH series. And if you have a baby through natural childbirth and the baby's born while you're in active infection with CMV, it can cause a death of the baby. And the name of this disease is acute febrile illness. Now, in people with AIDS, what do they not have? They don't have an immune system. Particularly, they don't have T cells. And it also affects B cells that make antibodies. And what happens is that people, in the first days when people first had AIDS and we didn't know much about the disease, and their T cell count went from around 900 down to around 100, they were significantly impaired. Many of them got CMV retinitis, cytomegalovirus retinitis, and it caused blindness. And the only treatment was this one medication that cost something like $2,200 a month. And so many people in the early stages of AIDS had to choose, do you want to be blind or starve to death? Because you couldn't pay both. And now they have preventative medications for CMV retinitis, so you hardly ever see it. But remember, in the first days, and if people that have untreated HIV, they might get CMV retinitis, and it is extremely difficult to treat, extremely expensive. Now they have preventative. Remember, what they do to treat AIDS is, one, they try to keep your viral load undetectable so you're not killing your T cells and your immune system. Two, they try to give you medications that prevent you from getting the common illnesses that most people get, called opportunistic infections. So they give you Bactrim on a daily basis to prevent pneumocystis pneumonia. And they give you a cyclovir because 80% of all people have herpes, and you don't want herpes coming back and covering you from head to toe. So they take these daily preventative medications for specific opportunistic infections. And so that's how they prevent most of the CMV now. All right, the gamma herpes are the ones the diseases caused by Epstein-Barr virus. And two of them are incredibly popular, meaning lots of people get them, and that's B-cell lymphoma or Hodgkin's disease. I'm sure you've heard of someone with Hodgkin's disease. And also mononucleosis. Key thing to remember about EBV, Epstein-Barr virus. All but two of the diseases it causes are cancer. Two diseases it causes are not cancer. Mononucleosis, which is usually called the kissing disease, and people get it in high school. And the result untreated mono at times can go into this syndrome, and it's called chronic fatigue syndrome. So Epstein-Barr is not the only cause of chronic fatigue syndrome. It is one of the causes of chronic fatigue syndrome. Anybody know about chronic fatigue syndrome? The most famous person that has it is Cher. Remember how she's had 400 farewell concerts? All right, the reason is every day is basically hell for her. She feels like a person with mono every day. She wakes up, she has to sleep longer than most people, and you wake up and you're worn out because all night long you've had night sweats and you have a low-grade fever, but you wake up in the morning, you're a little washed out and a little dehydrated and not much energy, but you get up, you take a shower, you make your breakfast, and you're exhausted, you get a low-grade fever, it moves up to a moderate fever, and you go back to bed. And that's their life. Every least bit of exertion, and they get this low-grade fever, feel like hell, go back to bed kind of thing. And so it is, one of the causes is people with mono try to work through it. And by work through it, I mean continue their regular schedule. If you've ever known anyone that had mono in high school, what did the doctor say? Go home and go to bed for 4 weeks. You have to go to bed for 4 weeks. Why? They want your body to spend all of its energy making antibodies and getting completely over this and eliminating it from your body. If you continue to work, you're going to have a chronic condition. It's going to be forever. And so one of the bad things about mono is that you can't get teenagers to stop doing it. You know, they say, oh, but I have band, and then I have yearbook, and then I have cheerleader, and you know, all of these things that they have, and they think is important, but it can be the rest of your life if you don't take good care of things like hepatitis and Epstein-Barr mono, both of which say, go to bed and let your body take care of itself, and then they will come and give you regular blood tests and tell you when you can go back to a normal schedule. So remember that the gamma herpes virus is Epstein-Barr, the beta is cytomegalovirus, CMV, the alpha, 3 of them, HSV1, herpes simplex 1, oral, herpes simplex 2, genital. Can you get genital in the oral area? Can you get oral in the genital area? Good, okay. And then VZV, varicella zoster, which is chickenpox and shingles. Then there's one that we don't know exactly what the arrangement of the genes are, but almost everyone believes it's gamma, and that's KSV8, Kaposi sarcoma virus 8. In the early days, when we first discovered HIV existed, the people that got it, the first symptoms, remember you get it, and it takes 10 to 15 to 20 years before it shows an outward symptom. That's why 20% of all the people in the United States that have HIV do not know it. They're walking around with it because how do you get it? From sex. They had sex. If you have unprotected sex, you can get this. If you get it, will you know you got it? Not for 10 to 15 years. Now, a blood test will show up in 90 days, but nothing will tell you tomorrow. So, anyway, the first visible symptom is pneumocystis carinii pneumonia, called PCP pneumonia, and KSV, Kaposi sarcoma. Kaposi sarcoma, if you've ever worked with AIDS patients, almost everybody has seen it. You don't see it much anymore because people keep their viral load at 0 and they don't progress this far. But in an end-stage AIDS, when you have less than 200 T cells, KSV comes out of hiding. And guess how you get it? Kissing. That you guys do with the snake thing? Yeah. Dentists and microbiologists freak out whenever somebody says, oh, I was French kissing him all night. Oh, gross! You know where your nastiest hole is, right? Your pie hole. None of your other holes are near as nasty as that one. All right, so This virus, 80% of you have it already. You have done that with somebody, haven't you? You probably got it. It's carried by saliva. Will you ever have the cancer? No. Unless your immune system is completely shut down from radiation, chemotherapy, or HIV/AIDS. KSV used to be called, if you went in 1960 and said, oh, this person has Kaposi sarcoma, you know what they'd say? Oh, they must be a little old Jewish man. It only showed up in people from the Eastern Mediterranean, Israel, Palestine, Turkey, Lebanon, Jordan, Turkey, Greece, Egypt. Showed up in the Eastern Mediterranean among older men where their immune system had gone down to nearly nothing. And it was a very slow moving, I don't know, most of my little bruises, sort of like this. It's like a purple lesion. And it's very slow moving surface skin cancer. And if you went to the doctor and said, what is this purple lesion? They do a biopsy and they say, oh, that's Kaposi sarcoma. And you say, what are you going to do about it? And they say, nothing. And you say, why? And they say, because it's so slow moving and surface that you'll be dead of old age before it'll be a problem. But people with AIDS and no immune system, not only is it's not just surface, it's deeply involves internal tissue and moves across your whole body in 6 months to a year and kills you. So it's very rapid if you don't have an immune system keeping it in check. Most of us have an immune system that even if you're carrying the virus, which 80% of us are, you will never have an outbreak, you'll never have this cancer because you've got a good immune system. But remember, people who don't, name the people who don't. Radiation, chemotherapy, and people with immune dysfunction like HIV/AIDS, Kaposi sarcoma can become very aggressive and move all over your body. Who gets it now? Only people with low immune systems and very old guys. And we don't know why mostly men. But, So, we have a few more minutes, so let's talk about treatment. Remember, there was no, I used to have up here, there is no cure for any viral illness. Now I have to put most. Can anyone name the 1.5 viruses that may have been cured? Remember, may have been is, I'm still qualifying it. You know why? It's been less than 5 years that they have declared cured. Remember, nobody cures anything in 5 years. If you've been free of it for more than 5 years, then I might be convinced you're cured. Otherwise, I think it may be probably hiding. You're not considered cancer-free until you're 5 years free of it. So anyway, can anyone name the 2 viruses that have finally been cured? Because we didn't think a virus could ever be cured because it inserts itself into your DNA. Now we realize that cells have a limited lifetime, and if that cell containing the viral DNA dies and hasn't replicated, perhaps we can clear a body of virus. Prior to this, we figured, no, we can't operate on DNA. Well, the 2 viruses are one genotype, I believe it's genotype 1, of hepatitis C, one of the worst. Transmitted by microscopic drops of blood, which is why you cannot share a razor or a toothbrush or anything that could contain microscopic drops of blood with anyone. So never use your boyfriend or girlfriend's toothbrush. Don't use their dental floss after they do it either. Disgusting. For God's sake, don't be shaving your legs with their razor. Remember, microscopic drops of blood pass hepatitis C. But we now have a treatment that is not very pleasant for people with a certain genotype of hepatitis C that has cleared the virus. Meaning that we went in and we tried to culture the virus from different parts of their body and could not find it. So this one may be cured, and believe it or not, HIV, in babies and in one adult. This one adult is not going to be you. This person had a type of leukemia. They irradiated their blood marrow, killing all their blood marrow and their HIV infection. They transplanted new bone marrow, and remember that only works about 30% of the time, and they lived and they no longer have HIV. The millions of dollars it would cost to cheat a person, this is not going to be you. But babies born from mothers that had HIV, and remember they pick it up from the mother's blood when they pass through the canal, or they get mother's blood in their eye or in the umbilical cut. If you aggressively treat them with antiretrovirals, 3 babies have now been cured. So we believe that there is a possibility of curing HIV early in infection. How? When they're very low in infection, not many cells have colonized it, it's not spread out to hidden reservoirs, hit it hard with antiretrovirals, and 3 babies have been cleared, meaning they cannot culture it anywhere in their body. Still, it's only been 6 months. So let's see what happens in 5 years if they're still clear. Yeah?
Why does bone marrow transplant only work 30% of the time?
I don't know. No, it's just not very. So let's talk about herpes. Herpes, there is no cure, but there is a treatment. And remember, when you're treating it, does everybody know what a cure is? I got 4 minutes. What's a cure?
It's never coming back.
It's never coming back, and it's not living or hiding in any spot in your body. Now, most of you think a cure is when you don't get the lesions or blisters. That's not a cure. That's in remission. So, it hides in the nerve ganglia, and when it's there, remember it's activated by the stress enzymes. And remember, if you're trying to prevent genital herpes, they're only effective 70% because you can't cover everything that might be infected. And remember, lots of people only use condoms when they think a person's having an outbreak, or I think he or she might not be clean. You know, you can't look at the outside or smell them and see if they're clean. You have to assume everybody's a nasty, filthy pig. Right? So the 2 treatments are, and most people use a combination of these. There is actually a nutritional treatment. I don't believe in herbs, you know that. But there is an interesting discussion about herpes. It loves a certain amino acid called arginine. In other words, you need a lot of arginine in your diet to help it reproduce. It needs a lot of arginine. And it despises lysine. Lysine seems to inhibit its reproduction. So, if you have a lot of fever blisters and things like that, you want to limit arginine in your diet to just what you need and nothing extra for the virus. And add lysine. Remember, it's amino acid, so it's not a drug. You can take as much as you want. So, now here's the bad news. Arginine's in everything you like. Coffee, chocolate, tea, anything that has caffeine has arginine in it. And so, you know, peanuts, all the nuts have lots of arginine in them. So you're going to have to, when you think you're under stress, you're going to have to avoid coffee, tea, chocolate, nuts to avoid outbreaks. And lots of people are able to control herpes outbreaks just by their diet. When they know they're going to be under stress, or when they feel the prodrome, they eliminate all the arginine, and they go down to a pharmacy and they pick up L-lysine. And they have 500 milligrams at every meal. Remember, it's a food, it's not a drug, so you can't get too much. And of course, it's best to eat the lysine in your veggies. It's just the veggies you don't like. It's all the dark green ones, you know. There's only one thing I ever agreed with George Bush in. There's nothing more disgusting than broccoli. Bleh. It smells like poo and it tastes like poo. But that has a lot of lysine, and so does spinach and all the dark green leafy vegetables. So remember, add lysine, remove arginine, and then, of course, the antiviral analogs. We'll start here next time. Could you turn off our little button there and hit the red one so it goes off?
Which one is it?
It's on the upper right.
Oh.